Good morning, everyone. Thank you for coming to Mary Center. And I am standing on behalf of Maria Gomez, the staff, and the board. And we would like to welcome you to our Fort Totten site. The most important thing about this event today is, as the Chief Medical Officer, I've had the pleasure of working alongside an incredible team and incredible partners. We have seen this devastating effect that's not only affecting the residents of the district, but across the country. And we're not done. There's still a lot of work that needs to be done in terms of getting shots in arms. And that's why we're here today. And the way we get that impact to happen is when we have partners such as United Healthcare, which has generously given us the opportunity to have this portable pod here. So we'd like to thank United Healthcare for their participation in that.
All right.
There is no partner that is higher or lower than the other. This also is possible with the mayor's help, with the absolute incredible work by Dr. Nesbitt and her team, and again, with the staff that we have here today. And so I would like to introduce to a community member who is actually somebody who has a lot to say about the vaccine. And not only are they a member of the community, but they also work for Mary Center. And that just shows who we are. That's not Megan, okay? And so that's not the person I'm introducing. But again, I would like to introduce Megan Bailey.
Good morning, and thank you. Welcome to our Fort Totten site. And I would just like to say that, when I first decided to be vaccinated, that was not my first decision. So if I'm being completely honest, when we first decided or found out that we had the approval to vaccinate, I had a lot of fear. And so where did that come from? I have been in the medical field for over 15 years, specialized nursing training for over 6 years. And I've taken care of some really sick patients as a previous step-down ICU nurse. And I've never seen features like this virus. And so I was really fearful. I was fearful because of the proximity that I have to the virus, that I'm taking care of these patients every day, of my children who are not quite of the age that they can be vaccinated, but because I am their mother and I need to take care of them, what happens if I get sick, or what happens if they get sick? Because I'm taking care of patients that are their age. And so I didn't sit with that fear. I went and I spoke with my colleagues. I spoke with my friends who are frontline workers also. I spoke with my primary care, and I did my own research. And so in December 2020, I decided that I would get vaccinated because I had an informed decision at that moment. And so I had the privilege to have access to the vaccine, and I had the privilege to have the valid information. And so that's what I want for everyone, and that's what we're trying to do. We're trying to make sure that everyone has access to the vaccine and everyone has that important information. And so I would say that if you're hesitant, if you're not sure, you're on the fence, don't sit in those fears and don't be silent. Much more importantly, don't be silent. Speak with someone that you trust, your trusted circle. That might be your primary care. That might be your friends, your community. I know that community hits home for me because Ward 5 is my home. I've lived here my entire life, born and raised. My mother is a retired ICU nurse who worked at Providence, not too far from here. My dad is a retired police officer and has served the community for over 30 plus years. So when I say community, that's home for me. So within the last year, home moved from me having love for my community than having that responsibility for my community. So I have the distinct honor in introducing to you guys, or letting her come up to the podium, our Mayor of the District of Columbia, Muriel Bowser. And I would say thank you for all of your tireless work that you've done alongside all the community members.
Thank you. Thank you. Well, hello, everybody. Well, that's a good Ward 5 welcome. I was born and raised in Ward 5, too. Not very far from here. Fort Totten, where we're right next to the Fort Totten Metro, was my stomping ground in many ways that connected me to all of the city. And it's so great to be with people from all 8 wards right here in the great Ward 5. Let's give everybody a big round of applause. I want to thank Dr. Elliott and Maria Gomez and the entire team at the Mary Center. Give them a big round of applause. Mary Center and their team have been on the front lines of this pandemic from day one, showing up in person, in service, making sure that people had testing, their regular medical care, and now is on the front lines of making sure that everybody gets vaccinated. I want to also acknowledge the incredible leadership of Maria Gomez, who told us that she was going to retire. And I think she's been at it for over 30 years, so she's earned it. And we want to just tell her how much we love her and miss her and how much her leadership has changed the lives, real lives of real people right here in Washington, D.C. So thank you, Maria. So let's talk about vaccination, because that's why we're all here. You heard directly from Megan a process that everybody goes through, asking questions about their medical care, talking to their doctors and nurses, talking to their friends, and learning more. We all go through that. And unfortunately, most everybody here has also experienced knowing someone who's had COVID, knowing someone who's died from COVID, and how simply devastating this virus and disease is. And so we don't want anybody at this stage where we have vaccine available to be getting COVID. And nobody has to die from COVID in Washington, D.C. So the only way that we can empower ourselves to change that is to get vaccinated. Are you with me on that? So I want to say thank you for the last 15 months, because DC, you have done what we've asked you to do. DC residents, DC businesses have made a lot of sacrifices. Our kids have made a lot of sacrifices. And because of that, we are crushing this virus. Give yourselves a round of applause. We also have the best doctor for Washington, D.C., don't we? So Dr. Nesbitt and the team at DC Health have been rocking it. They have been working hard, in person, face-to-face, smart, coming up with the data and the recommendations that have kept us safe. And I want to publicly thank Dr. Nesbitt and her team. Give them a big round of applause. But nothing would make Dr. Nesbitt happier is if all of DC got vaccinated. She's going to talk to you a little bit more about all that she knows about this vaccine, how incredibly effective this vaccine is, even for us who've been watching it for many, many months. When the vaccine became widely available in DC in mid-April, we saw our numbers of infected people in DC drop just like that. Just like that. From people getting the vaccine. And just like that, we were able to start opening our city back up. People able to go back to work. Kids able to go back to school. Right? And it's all because of the vaccine. But unfortunately, people are still getting COVID in our city. And unfortunately, we've still had deaths in our city. And we can turn that around by our own actions. And that's why it's important to get vaccinated. For 15 months or so, let me just put it this way, with things closed down and social distancing and everybody wearing masks, the world was kind of set up because we didn't have a vaccine and nobody was vaccinated. Fast forward, the world is now set up for people who are vaccinated. So if you're not vaccinated, you're putting yourself at great risk, and you're not doing everything that you can do to protect our little ones who aren't eligible for the vaccine yet. So you want to do something to help your kids and help us get school and keep school for the fall. You know what you can do? Get vaccinated. So that's what we're here to talk about today. Now, this is one thing that I have a lot of practice at, and these good people behind me are going to get a lot of practice at it. I've heard every reason why somebody don't want to get vaccinated. Haven't you, Dr. Nesbitt? I've heard every reason. And Dr. Nesbitt has told me every reason why they should. And so what we have before you are D.C. residents who are going to talk to their neighbors and friends. Let's hear it for our community core. Today, we are introducing, and I'm not scared of cicadas. Today, we are introducing 7 trusted community-based organizations that collectively have hired a team of 150 people who will be dedicated to engaging unvaccinated DC residents and helping them to make a plan to get vaccinated. These organizations have worked with us throughout the pandemic, and they are the Anacostia Coordinating Council. Give them a big round of applause. They are Check It Enterprises. They are the Congress Heights Community Training Development Corporation. They are the Far Southeast Family Strengthening Collaborative, the Latin American Youth Center, Marshall Heights Community Development, and the National Association for the Advancement of Returning Citizens. So give them all a round of applause. And in addition to this great team, DC residents also make up a great team. We've had 2 community days of action, and we're going to have a third one on Juneteenth, which is Saturday, June the 19th. And as we've done for previous days of action, we are going to go door to door and knock on the doors of our neighbors and make sure that they know how, when, and where, and that they should get this vaccine because it is safe and it is effective and it's going to let us all get back to life. So with that, I want to introduce our Dr. Laquandra Nesbitt.
Thank you, Madam Mayor, and thank you for your leadership during this time and making all of those sometimes very tough decisions that undoubtedly helped to keep us safe over the past 15 to 16 months. So this is a remarkable day. We're so excited to have so many people in our community who want to continue to be good neighbors. So investing in the community core, being a member of the community core, is the best type of citizenship that you can demonstrate by sharing all of the information that you've learned about the importance of vaccination with all of the people in the community, those who live in your neighborhood, those who go to your places of worship, those who are involved in community organizations with you. Everybody needs to hear the message. I know I've been given a big stage over the past 16 months, but I can't carry us across the finish line by myself. And it's tremendously important that people get to hear from people they trust. While I know a lot of people trust me, I know some of them trust you more. And so you knocking on their door, meeting them at the barbershop, the beauty salon, the stores, the retail locations, the restaurants, all of these places that they go to, as the mayor said, that is now set up for the vaccinated, to ensure that they become amongst the vaccinated in DC and have the ultimate protection for themselves, and especially for our children who are not yet old enough to receive the benefits of the vaccine. You know, we're just days away from meeting the goal, the pledge that Mayor Bowser signed on to, that 70% of our adult population will be vaccinated. We're excited about that goal, but I'll tell you that my dear friend Dr. Fauci said, well, why aren't we all aspiring to 95% of our adult population being vaccinated? And I know in your heart of hearts, that's exactly what you're doing. You don't want anyone to miss out on that benefit. So we're going to plow past 70% and get as close to 100% as we can in our community. Why? Because that's going to help us move back past this pandemic, but it's also going to help us on our quest to become the healthiest city, or soon to be state, in America. So again, just thank all of you for your tremendous work, your tremendous commitment to our city and to each other over the past 16 months. And I look forward to all of your efforts to help us get vaccinated here in D.C. Thank you. Woo-hoo. And now you're going to hear from Erin Henderson Moore.
All right, Erin.
Hello, everyone. It's good to see you. My name is Erin Henderson Moore, and I'm the Executive Director for United Healthcare in Washington, D.C. We're proud to serve around 12,000 members in our Medicare and Medicaid plans. So really those people with the most complex healthcare needs. So those are people with disabilities or seniors and people that are income eligible for Medicaid. So we're really proud. You'll see my team, a lot of them are over there, clinical staff, really dedicated to making sure to highly focus on health equity and meeting access issues. So we're honored to be here. So I just wanted to say thank you. I'll be quick. I know it's hot. So thank you so much for the support from Mayor Bowser and Dr. Nesbitt and the Mary Center team. We're honored to be here to do a ribbon cutting for this new mobile vaccine unit that you'll see there if you have not already seen. We're really highly focused on making sure that care is delivered exactly to the communities and the people that need it most. You'll hear us saying that. So please, if you see me, I'm highly, highly focused on health equity and making sure that those needs are met. Everyone who gets the vaccine will help us ensure that the pandemic can stop, that we can stop the pandemic and get back to doing the things that we love and seeing the people we love, and we can have more activities like this. So please join us in our mission. We're really excited that you'll be here. And we're just with that, we would just echo what Megan and Dr. Nesbitt and Mayor Bowser said, is really just talk to your community. Feel free to flag one of us or one of the healthcare professionals here. We've all gotten the vaccine. We're here. We're proud, and we'd love to continue to talk to you about it. So thank you so much for the opportunity to say a few words, and I will turn it back over for question and answers. I think that's back to you, Madam Bowser.
Thank you. Thank you, Erin, and thank you, United. Having a mobile unit is very important. I can't tell you the number of events that I've been to recently, because now we can see each other in person, and I can take off my mask because why? I'm vaccinated. Okay, and so, and people say to me, well, why don't you bring it here? So we're going to bring the vaccine and be able to have vaccine at a lot of events, but also at a lot of places right in your community. So I'll take a few questions. We'll start with press questions, and then we may have time for a few community questions, and then we're going to cut the ribbon. Any press questions? Questions? Yes.
Beatrice Peterson, ABC News. Tomorrow, capacity limits lift in the city. Can you talk to me?
Can you come up a little so I can't actually see you? There you go.
Hey, how's it going? Beatrice Peterson, ABC News. Capacity limits in the city lift tomorrow. Can you talk to me about how you're feeling about the lifting of restrictions on capacities across the city?
Well, we most largely lifted capacity limits several weeks ago, and they're all going to be lifted, including the large venues. So the stadiums and the bars that in nightclubs that were at 50% capacity are now 100% capacity, and I feel amazing about it. DC is open. We've made the sacrifices necessary to get this virus under control. We're putting all of our effort towards making sure people who have been hesitant, I don't really like that term because I think sometimes people are just a little bit slower to make a decision about something. But now they've had 7 months, more than hundreds of millions of vaccine doses have been administered. So people who wanted to wait and see, you saw. Now it's time to get your vaccine because the city is open and we want to get back to business. So I feel good about it. I feel like since we largely opened everything 3 weeks ago, we haven't seen spikes in cases, and that's because people have been getting vaccinated.
And just off-topic follow-up.
Yep.
Earlier in the week, Eleanor Holmes Norton said that she was disappointed that the January 6th bipartisan report did not give D.C. control of the National Guard. Do you have any thoughts about the report that came out earlier this week that did not give recommend DC to have control of the National Guard?
We know that's going to be a matter for the members to take up. The Congresswoman has a bill. Chris Van Hollen, a senator from Maryland, has a bill. And we're counting on them to get it through the Congress. And we will explore other methods to get more control as well. Any other press questions? Yes.
Could you just talk more about this vaccination, this pod here?
Sure.
You know, how many people it can, I was shouting.
Sure.
How many people it can, take at a
Absolutely.
time? Is it going to move around?
Okay, let me ask Dr. Elliott to address that.
So the pod has 4 rooms in it. It can actually accommodate 200 in a 4-hour period, so you can get 400 people in an 8-hour day. And so it is mobile. You can put it on a flatbed. The company that makes it actually has a rolling flatbed version of it. But what we have here today is what we've been using for the Faith and Vaccine Initiative. And certainly, again, with United Healthcare, it allowed us to bring this here to our site.
Are you planning on moving it around?
Working with Dr. Nesbitt's team, absolutely.
Hi, this is Rachel Chasen with The Post, and I was just wondering if you could talk a bit about if you have any concerns on the neighborhoods where vaccination rates are lower, and what reopening could mean for those areas.
I am concerned about areas where vaccinations are lower because I know the risk that those residents and their entire families are facing. I know, too, that those residents and their entire families are engaging with the world. They're not staying home, okay? So if you're not staying home, you're going to events, you're going to work, and we know that work centers are turning up, so people are going to be called into work. They won't be able to work remotely as much as they have been, and children need to go to school. So I am concerned that communities that already have higher levels of chronic conditions that are difficult for COVID, and when I say that, I mean that they will kill you, okay? High blood pressure, heart disease, obesity, all of these are very high risk that if you contract COVID, your chances of surviving are much, much less. And so that's why we went to trusted organizations in the community that know their neighborhoods, know community leaders, know how to get people out to the free vaccine sites that are near their homes to get vaccinated.
Hey, Mayor. Tom Rousley, Channel 7. Question about the DMV and the latest change announced today, and I wanted to ask you, why won't, at this point, the DMV just open up to walk-in appointments? Because we're still hearing from folks who are having trouble doing things online and arranging appointments.
Well, you also know that we announced 10,000 appointments today, and we still think it's better for people to know what time to go, rather than everybody show up at the DMV at the exact same time, okay? Because then you know what you're going to be asking me? Why are 300 people standing in line at the DMV and it's 90 degrees out, all right? So we got to have you bear with us so that we can get all of our employees at the DMV so that we can open up all of the centers and have as much service as possible. And we expect that that's going to happen. You will recall, and Dr. Nesbitt may not like this comparison, but at one point, nobody could get an appointment for a vaccine. And the very next week, we had more vaccine than we had people. So we know as we turn things on and everybody wants the same thing on the very same time, that will smooth out, and people will be able to get access to appointments. But let me say this. You don't need to go to the DMV for most things. I'm going to repeat that again. You do not need an appointment to go in person to the DMV for most things. For example, if you need to renew your tags, if you need to renew your registration, you do that online or you do it by mail. You do not need to go to the DMV for most things. If you have a ticket and you need to pay it so that you can get your tags renewed, you do not need to go to the DMV to do that either. If you already have a real ID that has expired, you do not need to go to the DMV to do that. You do that online or you do that by mail. There's some things that you need to go for new vehicle, and I don't even think that. I think you can do your new vehicle there too, actually. But there are other specific things that you have to go in person for. And so look for those appointments, look for them weekly. They will becoming more and more plentiful.
And about the folks, though, who have been used to going to the DMV, they've done it that way for many, many years, and they're just not used to this process online. And in some cases, they're getting tickets for things they haven't been able to do yet. What do you say about that?
Well, I don't know that they have been getting tickets for things that they can't do online. I don't know that that's true. Now, they could be getting tickets, let me just tell you this, for parking in a rush hour zone. You're going to get a ticket for that. We started enforcement on June 1st after no enforcement for 14 months. If you're parking illegally, you're going to get a ticket. You also need to take your vehicle through inspection. You could be getting a ticket for that. And you don't need an appointment. It's first come, first serve at the inspection station. So moral of this story, you do not need to go to the DMV to do most things. So check and read the website for everything that you need to do online. Any other press questions? Any community questions? Yes, ma'am.
Hi, I'm a resident of Ward 5.
Yes, ma'am.
And I've actually been vaccinated, but
Amen.
What concerns me are the variants. I heard over the news that there were 5 that came in like it was from India, which is a real hot spot. And I heard today that it's another variant that has been identified. So has the district considered variants and how that's handled? Because people are coming in, going out, and I'm afraid of them coming back here, and our vaccine won't be any good.
Right. Let me ask Dr. Nesbitt to address your question.
Sure, thank you for that. And you know what asking about variants gives me the opportunity to do is to tell you to get vaccinated. The faster that we vaccinate our population, the more we can protect ourselves against variants. If we reduce the number of people who are going to be exposed to the virus, whether it be the original wild type virus or the variants, we will protect folks, right? If you are vaccinated, you're protected. So we monitor for variants here in the District of Columbia. We don't have the higher rates of variants that some other states like Michigan has or New York has, and we keep our eye on that on a weekly basis. But it is so important that people do not delay to get their vaccine. And none of this talk about, well, if I got to get a booster, I'm going to wait. If I got to do this, I'm going to, none of that. Get vaccinated, and we won't have a variant problem here in the District of Columbia or in the region. So let's plow across that line. There's still data that comes out frequently. 91% of folks who have been vaccinated in the real world setting have a reduced risk for hospitalizations for getting the virus and almost 100% risk of not dying from COVID-19. So that's real world data, not stuff from a clinical trial. It's all of us who've gotten vaccinated providing information on a regular basis.
So have you guys identified any in Ward 5?
It does. Yeah, thank you so much for that question. So we have tracking. The CDC has what they call variants of interest and variants of concern. The variants of concern are more serious, meaning that they may reduce the likelihood that a medication or a vaccine works. Less than a third of our cases are related to variants. So we're in a good place. There's some jurisdictions that 80% of their cases are related to variants. And they're still seeing declines in rates, which means that the vaccines work in the real world setting.
That's a nice question. Thank you. Any other community questions? I can take a couple more. Yes, ma'am.
Yes, I'm a volunteer chaplain at DC Jail. I'm 84 years old. And I want to know what's happening over there at DC Jail. Because I'm a chaplain, we are not allowed to come in now because of that.
Right.
But I'm concerned about some of the inmates that call me. So I just want to find out exactly what is going on with DC Jail.
Okay, so the question was about DC Jail. And let me start out with how we're doing with vaccination, because I just asked about this number yesterday. We have about a third of our residents there who are vaccinated, so I think just over 500 out of 1,600 people who are at DC Jail. And that's not bad. That's not a bad number. I like it to be a lot higher. I feel very, we feel lucky, actually, that in our congregate settings like DC Jail, like our homeless shelters, we did not have a terrible experience with COVID outbreaks or deaths. So we have to feel like all of the procedures that we put in place kept people alive. We are also working with our staff at DC Jail to make sure that we're driving up vaccination numbers at DC Jail. The leadership in DC Corrections is also and has also loosened some of the movement restrictions among our residents there. And we look forward to it getting back to a 100%. But one of the worst things that can happen, as we've seen around the country, is an outbreak in a facility where people can't leave, okay? And so we've gotten some criticism for restricting movements, but I know for sure that we kept people alive in a facility where people can't leave, okay? Any other community questions? Yes.
As far as you guys not being able to let them interact with the people in their community outside of the jail, what are you doing mentally for them so that they aren't like, because I know for me, COVID was hard for me being at home alone and just being in the house and not doing anything. So for them, they can't leave, they can't go anywhere. So what are you guys doing mentally to keep them going?
Well, we have been able, the question was what's happening on the inside of the jail to keep people engaged mentally and psychologically, and it's much more difficult in that setting. One of the things that we've learned that we're going to maintain post-COVID is having iPads and laptops that are allowing for the type of public education and connection virtually that everybody has been experiencing during COVID. And I think that the DC jail leadership has found that has been helpful in preparing people to re-enter. So not everything about COVID has been bad. We have learned some things, including in corrections, that we'll maintain. Okay, last question, Ms. Riff. Good.
Years had a exercise program. With the COVID to cut off, if everything else is opened up, Channel 16 needs to put back the exercise program that we've been part of over 25 years.
Exercise program on Channel
16? 6 a.m. It's been there for 25 years. It was cut off for COVID, has not come back.
Yes, ma'am. Well, we'll get right on that. I like that one. Let's get on it. You heard it. You heard it here in Ward 5. Ward 5 wants to work out. All right, let's cut the ribbon.